Hi everyone, I'm Dr. Stan Steindl. Last week I spoke about 5 evidence-based benefits to mental health of compassion-focused therapy. But compassion-focused therapy and compassionate mind training have benefits at a general community level as well, promoting psychological well-being in all sorts of people in all sorts of ways. So check this out. 5 more evidence-based benefits of compassion-focused therapy in our community. Number 1, compassion helps on the home front. Let's think about children and parenting. Well, we're a funny species in that when we have kids, they need to be looked after for a very long time. Sometimes they don't leave home well into their 20s. But especially early on, children need their parents to meet their physical and emotional needs and their needs to feel safe and secure, cared for and supported. And so parents try to be sensitive to their child's needs and distress and then respond in helpful ways. Sadly, we know that children can have very adverse experiences sometimes at home and with parents and caregivers, with devastating effects. So it can be very important to help parents cultivate a compassion-focused approach to their parenting. This might mean developing parents' skills and competencies of the compassionate mind, directing their compassionate motivation towards their children, and cultivating an environment that's safe and secure and where the parent is present, available and offers closeness and connection to their children. James Kirby and Kirby Tellegen wrote about this in their 2021 chapter, Parenting, Family Environments and Mental Health and Illness, in the book Making an Impact on Mental Health, the Applications of Psychological Research, edited by James and Paul Gilbert. Their chapter outlines the emerging evidence of compassion-focused parenting. One particular study described in the Kirby and Tellegen chapter that stood out for me is the adaptation of the Triple P parenting program, originally developed by Professor Matt Sanders at the University of Queensland. The lead researcher of this study, Dr. April Huang, along with Kirby, Sanders and colleagues, modified the existing Group Triple P program to include 2 sessions of CFT psychoeducation and techniques as part of her PhD thesis. Working with a sample of Vietnamese families, the results included reductions in conflict between parents and grandparents and improvements in prosocial behaviours in the children. Super interesting results and well worth pursuing in further research. Number 2, compassion helps in schools. Schools are such important places. As a parent myself, I've often marvelled at the undeniable benefits of certain teachers in my kids' educational journey. But it's tricky, and there can be change or challenges and stresses for teachers and students alike. It seems to me that schools are such an important place to explore the benefits of cultivating compassion. Professor Frankie Maratos from University of Derby, along with several colleagues across the UK and Europe, have been working on a Compassion in Schools project for a few years now. In one published study in 2019, Maratos and colleagues evaluated a 6-session, 2.5 hours per session, compassionate mind training intervention with over 70 school teachers and support staff in the UK. The program was well received by the participants and led to increases in self-compassion and decreases in self-criticism. There were some challenges for the teachers and school staff, such as finding the time for sustained practice of the CMT strategies. But the study offered some very useful suggestions and recommendations regarding implementing CMT in schools. As part of the same project, A 2021 paper, this time led by Matos, along with a number of colleagues, reported a pilot study of a compassionate mind training intervention to promote teachers' well-being, this time in Portugal. In this study, the 6-session CMT intervention resulted in significant decreases in depression, stress, and fears of compassion to others, as well as significant increases in compassion to others and self-compassion and compassion to others motivation and action. The finding regarding self-compassion and compassion, motivation and action is extra special for me because the authors used the compassion, motivation and action scales that I and a number of colleagues developed at the University of Queensland. So great to see it being used and finding useful results. In terms of the students themselves, I think this is a very worthy area for future research. First, does CMT with teachers also lead to benefits for the students? But second, is CMT with the students themselves helpful? One study I found looking at this used CMT with adolescent students who were experiencing test anxiety by Driscoll and McAleese from 2021. A preliminary investigation. The adolescents who received the 8-session CMT course showed reductions in test anxiety and general anxiety, as well as significant increases in self-compassion compared to the control group. I'm sure there might be more out there on the topic of CMT with students, but also we need more. Number 3, compassion helps at work. Researchers Kotera and Van Gordon from the University of Derby published a systematic review last year of the effects of self-compassion training on work-related well-being. While not specifically CFT or CMT related, I thought this was well worth sharing with you all as a fairly up-to-date look at compassion at work. They identified 10 studies using a variety of self-compassion training interventions, generally with workers in a caring field. The interventions included compassionate mind training, mindful self-compassion, the Cultivating Emotional Balance program, compassion cultivation training, and various other mindfulness, loving kindness, and compassion meditation programs. The findings of this systematic review indicated that self-compassion training can improve self-compassion and other work-related well-being outcomes in working populations. The CMT study included in this systematic review was the one I mentioned before, led by Frankie Maratos, evaluating CMT with school teachers and other staff. So there you go, some interesting crossover there. The authors of this systematic review also concluded that more needs to be done in this area, with greater methodological rigour, broader application, especially in non-caring professions, and also across cultures and in non-Western countries in particular. Number 4, compassion helps us cope with COVID. All the world seems to be focused on COVID at the moment, and rightly so. It's a big thing that's having a big impact, whether it be the direct effects of catching the virus or one of its variants, or the indirect effects of lockdowns, quarantine, isolation, disconnection from family and friends, effects on work, effects on school, financial effects. The list goes on. I've spoken before about a multinational study across 21 countries that I'm involved in, along with others from around the world, and led by Matos, exploring compassion, social connectedness, and trauma resilience during the COVID-19 pandemic. And the findings from this study are really starting to build a picture of how compassion and self-compassion might be able to help us during these difficult times. Firstly, we've found that compassion can protect mental health and social safeness during the COVID-19 pandemic. The results of this paper indicated that higher perceived threat of COVID-19 was associated with poorer mental health and reductions in social safeness. However, we also found that self-compassion and being open to receiving compassion from others were related to less psychological distress and higher social safeness. So the conclusion we came to was that compassion does seem to have a universal protective role against the harmful effects of the COVID-19 pandemic on mental health and social safeness. Secondly, we found that fears of compassion magnify the harmful effects of threat of COVID-19 on mental health and social safeness. Remember, this study is across 21 countries, and this finding too was universal. So here we concluded that compassion-focused interventions and public health measures could be implemented to reduce resistances to compassion and therefore promote mental well-being during and following the pandemic. Thirdly, we explored the role of social connection on the experience of COVID-19 related post-traumatic growth and post-traumatic stress. This study found that, in fact, social connection is key to how people adapt and cope with the pandemic and may help to facilitate post-traumatic growth in the context of all this threat and stress and trauma. Unfortunately, social disconnection increases vulnerability to develop post-traumatic stress in this threatening context. We really have to watch for social disconnection, look out for people, and try to bring everyone along with a good sense of connection and belonging. It's not easy, but these results suggest it's really important. Number 5, compassion is good for anyone and everyone. So compassion helps on the home front, helps in schools and at work, and helps us cope during this stressful time of the pandemic. But you know what? Compassion is really good for anyone and everyone. Chris Irons and Charlie Heriot-Maitland evaluated their Compassionate Mind training course recently in a general population sample. Following their 8-week CMT groups, 55 participants from the general population showed significant increases in compassion, self-reassurance, social rank, positive emotions, and well-being, alongside reductions in self-criticism, attachment anxiety, and distress. 22 participants were followed up after 3 months, showing that changes were being maintained. More research is required, and we're currently ramping up to do a CMT trial this semester with students at UQ. But CMT appears to be applicable and beneficial in community samples. Thanks for watching. If you enjoyed this video or found it useful, please hit the like button, subscribe to my channel, or perhaps even share on your socials. Let's spread the word that compassion helps.